Greetings and welcome to the Idlewise Forum's interview with Dr. Nancy Waite-O'Brien. This is our third interview with mental health professionals offering their services to our mountain communities as part of the six-part mental hygiene workshop series that we're sponsoring in Idlewild, California through the months of September and October 2022. Dr. Nancy Waite-O'Brien is a psychologist, educator, and author with over 30 years of experience in psychology and addiction treatment, both in the United States and in the Caribbean. In 2004, she was named one of the 60 most influential women in the field of addiction treatment by Counselor magazine. She wrote the introduction to Betty Ford's book, Healing and Hope, has co-authored texts on adolescent treatment and on women's treatment, taught at Chapman University in Palm Desert, California, was adjunct faculty in the Equine Assisted Mental Health concentration of the Counseling Psychology Department at Prescott College in Prescott, Arizona, and published research on shame and depression in early recovery. Dr. Waite-O'Brien was associated with the Betty Ford Center for 18 years, and in that capacity, oversaw clinical services and training for that organization. Currently, she has a private practice in Rancho Mirage, California, provides equine assisted therapy to a wide variety of clients, including women veterans, and is a consulting psychologist for the ABC Recovery Center in Indio, California. Her doctorate in psychology includes an emphasis on the treatment of addiction, and she has specialized training in equine assisted psychotherapy, hypnosis, cognitive behavioral therapy, eye movement desensitization and reprocessing, EMDR, and is a practitioner of somatic experiencing, a body-based approach to treating trauma that we've also discussed in previous interviews. Welcome.
Thank you.
Yeah, and thank you for taking some time to do this interview. How did you find yourself moving into the psychotherapy field in the first place?
My first career was as a school teacher, and I taught chemistry back in the 70s. And in that point, kids, and really sometimes the really smart kids, were getting into trouble with drugs. And that was really upsetting to me because I really liked the kids I worked with, and I felt ill-equipped to help. So I got a master's degree in counseling, and moved at that point to the Caribbean. I lived on the island of St. Thomas and worked with the Council on Alcoholism there. And after about 8 years, I decided that I really wanted more, to learn more. So came to California and got my doctorate. And after that was when I started working at the Betty Ford Center. Delighted to be there for quite a number of years. And then left there about 15 years ago, and now work on my own with a private practice. Also, because I have a herd of horses, I work with people and horses, and consult with a treatment center down in Indio called the ABC Recovery Center.
I'm struck that curiosity has been a real driving force in your life, and that has led to a lot of development in terms of just going deeper into these fields, these issues.
Yes. And I the other thing that I also talk to people about who are considering, should I get more education? I was 50 when I got my doctorate. That it is never too late to get And I talked to somebody recently who was in her 70s, and she said, do you think it's too late for me to get a master's degree? And I'm thinking, have at it. You know, we're here on this planet to learn and to be help to others. And sometimes that requires a little more education.
Mm. So you've done this research on shame and depression in early recovery. We haven't really talked a lot in this series so far about just the problem of addiction, the challenge of it, not only for the person facing the addiction, but for all the loved ones, of course, too. It's certainly can be a family and even a community problem. I remember a few years ago, there was some reporting on how Portugal took a very different approach to dealing with addiction, where they took the funding out of the criminalizing of piece of dealing with addiction and put it into social programs and so on. The heart of that was this idea that shame is actually really a big driver of addiction. So shaming people and criminalizing the whole cycle just seems to exacerbate the problem. What are your thoughts on that?
I absolutely agree. I think that shame is a core issue in addiction, and it's often present before the person even starts to drink or use. When I interview people who are in the middle of their addiction or maybe considering sobriety, I'll often ask, what was the problem you were trying to solve by drinking or using? Or what was the problem you were trying to avoid? And because alcohol and drugs do a pretty good job of allowing people to deny or ignore painful feelings, at least for a while, until you can't anymore. And trauma and the resulting shame is characteristic of most, if not all, alcoholics and addicts. That's part of either the experience before they started using, and certainly it's a part of the experience as the disease gets out of control. So when I did my research, what I was looking at was particularly gender differences between men and women and the incidence of shame or guilt. And not surprisingly, I found that women tended to exhibit and report more shame as connected to their drinking and also connected to experiences that they had either before or during their drinking. It left them feeling worthless and not measuring up in terms of their own expected role in their own lives, as maybe as a mother, as a partner. It just was part of every woman's experience.
So Brene Brown kind of talks about the difference between shame and guilt, that shame from her perspective is more, it's not like you're participating in a bad behavior, but you are bad or something, like you're internalizing that. Yeah.
And she is right. One of the things that in recovery, in 12-step recovery, there is the expectation that you make amends for behaviors in the past. And making amends or apologizing is a really effective way to shift from shame into guilt and then find a way out. See, if shame is I am a failure, guilt is I did things that I'm not proud of. And if it's about what I did, I can make reparation. I can apologize. I can not do it again. I can pay back what I owe. There's all sorts of ways that people heal as soon as they can shift to realize it's not me who's awful, it's what I did. And I can change that.
It strikes me that this concept of feedback loops keeps coming up, and it seems like addiction can create a feedback loop, and a negative, again, I'm putting negative in quotes, but a feedback loop where it can make it difficult for the person's loved ones around them, and which then can probably drive more shame and more addictive behavior and so on. How can loved ones and people dealing with addiction, how do you break that? What's the most effective way or ways that you've encountered to break that cycle?
Well, the thing about being loving an alcoholic, the thing that's or an addict, is to understand that you will never be first. That the drug or the alcohol will always be the first. That's the true love in that person's life. And if you can understand that and accept that that's the deal, you will never be more important than that person's next experience with drugs or alcohol. You can survive, because then you don't feel crazy and worthless, because you understand that the person is being driven by their need for a drug or for alcohol. And you could be a little more objective and not feel like somehow you're responsible. And that brings me to the other part, which is understanding that you love somebody who is an addict, but you're not the person, you can't fix them. And you're not a treatment center. And it's coming to the understanding that you can care and love this person, but you may not be able to change them.
Mm-hmm.
And that will buy you a lot of sanity.
Mm-hmm.
It's not fun being with an addict or an alcoholic. It feels often like you're the one who's in trouble, and you're the one to be blamed. And so it's hard to keep one's perspective. And that's why groups like Al-Anon are really helpful, that they help people sort of listen to somebody else and get some good, solid advice about how to cope.
In a way, isn't that kind of a step in maturity anyway, kind of realizing that you're not the be all and end all for one person? Like, I think we have this concept of romantic love that we're spoon fed in the movies and everything, that, this one, like two people can solve everything for one another. And I think if we grow older, wiser, we realize, it's not all about us.
Yeah. That you're right, that it is. Sometimes I think about, sort of this idea of being with somebody, not being responsible for somebody.
Mm-hmm.
And that oftentimes it feels like you're responsible. I should do something. And I read a book many years ago about alcoholism, and I thought that was what the author said, that oftentimes when the family figures out that the problem is addiction, that can be for them an amazing bit of news, and they feel like, I can do something about this. For the addict or the alcoholic, that news feels like an accusation, and they're not going to be welcoming to somebody saying, oh, you're an alcoholic, now we could do something about that. That just means you're getting in the way of my next drink. And that isn't welcome.
So what about the other side of the relationship? What about the addict or alcoholic? What are the most successful treatments or practices to break that cycle, if you have that? And again, there's this idea that the addiction isn't just necessarily about drugs and drink. Addiction can also be to overworking or all kinds of different things where maybe I should first ask, at what point is something considered an addiction?
I think behavior becomes addictive when it intrudes on the person's ordinary day. That if I'm all of a sudden paying attention to food, so that I'm not paying attention to other parts of my life, or gambling, or sex, or drugs, or alcohol, if it impinges on my normal activities, I probably need to look at it as addiction.
Including bad news on the on the internet too, probably.
Yes.
Right? And social
Yeah,
media.
the internet is a place where people can get, if you think about particularly internet games, and there is a feedback loop in that you get rewarded for what you do. And we like reward. That fits with our nervous system. Is I get a reward, I'm going to do it again. And then it just keeps going, and then it becomes problematic.
Yeah, I was listening to a talk recently about how gaming is very addictive, partly because people that are in the game are gaming are in the flow state, which is a very, we are doing our best work often when we're in the flow state. It's kind of creates a feedback of reward, in the sense that we're becoming increasingly skilled at something that we're challenged by. So it really arouses the curiosity and so on. And it becomes super salient for us.
I read a research study many years ago that has stuck in my mind, had to do with chickens, and that they were training chickens that they would be in a box, and there was a big red button in the box, and if the chicken pecked on the red button, it got a piece of corn. And it didn't take the chicken long to figure out that every time you did this, you got corn, and that was delightful for the chicken. Then they thought, all right, let's see how long this will go on if we cut down the frequency. So what they started with was every other peck corn, and then every third peck corn, and it kept going. A longer interval between rewards, and they found that after a certain amount, the chicken lost interest. It was like it wasn't worth it to keep pecking again. So they tried one more iteration of the test, and that was intermittent reward. That there wasn't a pattern of reward for the chicken. It just, every once in a while, after so many pecks, it would get, at that point, the chicken would keep pecking until it exhausted itself. And I think we are like that with intermittent reward, we're caught. We can get in, and we're always hopeful that maybe the next one will work. That works for gambling, that works for all sorts of addictions.
Yeah, and that works with the flow idea too, because you're being challenged, but you're not being bored, because there's the unexpected. You don't know when it's coming, so you just keep going. Interesting.
Unrealistic hope.
Yeah. So I forgot, where did we leave off though in terms of what actually works or maybe we didn't get to that yet. What works for people?
I think that the point at which an addict or alcoholic comes to the realization that they are doing and acting in ways that they never imagined themselves doing. And I view that as like a soul injury. That at the point that I'm doing something that I wouldn't be able to tolerate, if I could look at it in a sane way. I had an experience of a long-term connection with a man who lived in the Midwest, and he wanted to figure out how to manage his alcoholism. And what I said to him was, I think you'll know when you're done when your soul can no longer tolerate what your body is doing. And he agreed. It took a little time, but it came to the understanding that there is an interior part of each of us that holds our best self. And when I violate that best self because of my addiction, and I can see it even for a minute, there opens the possibility that I might be willing to change. It's very internal. Sometimes it doesn't happen when others expect it.
So that's the rock bottom people talk about. Is that, and you refer to that as soul damage?
Yes.
That's such a powerful idea.
And I'll give you an example. A family member was doing a lot of drinking. He was married, had kids, 7 of them, and he loved being a father. That was the best part of his life, was being a dad. And one night he came home and his youngest child met him at the door. And she said, "Dad, I'm afraid of you when you drink." And that was enough. He was in a treatment center the next day. And I think that was the reflection of soul damage, of a soul injury, that it hit the part of him that really was so extraordinarily tender and vulnerable. And he realized that he'd crossed into the place he'd never wanted to be. And he was sober for more than 30 years after that moment.
What's powerful there is also that it was about connection, his connection to his daughter. And probably a lot of people that are struggling with addiction are missing that connection in their lives. Well, so on Saturday, we're not going to be just talking about addiction. It's going to be focused more on depression and these tools for dealing with depression, cognitive distortions, and so on. Would you like to talk a little bit more about that work?
Well, I think about one of the things that I'm going to sort of begin with is the understanding that oftentimes, not always, but anxiety is about things that are ahead of us, and depression is about what's behind us, what's already happened. But if I can stay in this moment probably isn't all that bad. Now, and I'm hoping during the workshop, that would be a good moment to be in, is sort of that oftentimes, if we get focused on either what happened or what might happen, we're going to be either anxious or depressed. But if I can stay in this moment, I'm probably going to do all right.
Do you recommend mindfulness practices and meditation?
Absolutely. And my experience is that with clients is that those who are willing to try mindfulness and meditation really find that they can have a different perspective on how life is running.
How about, I know you also do EMDR work, and trauma work. Would you like to talk about that a bit?
Trauma work is taking a look at a moment, or not just a moment, it can be a whole chunk of a person's life where it doesn't feel safe. And that's what trauma is an experience of loss of control and the loss of the feeling of safety and predictability in one's life. And that can be terrifying in the moment, and then it can come back in the form of flashbacks that make the days afterwards and the months and years afterwards frightening. because you don't have the sense of being controlled of your own mind and your own thoughts. And so the approaches like EMDR and somatic experience, what they do is they help people address that specific experience of trauma and to allow that to release. It can be done with the body experience, it can be done with EMDR, but it somehow lets the brain release some of the painful experience that the person's gone through.
Yeah, okay. Well, is there anything else you'd like to talk about before we wrap this up? This has been an engaging dialogue.
I think we've covered a lot this morning.
Mm-hmm.
And I look forward to Saturday and to take it one step further.
Wonderful. Well, thank you so much for participating in this series, and I look forward to hearing how it all goes. I hope you have, yeah.
I'll keep you posted.